Dr. Mike Ryan, Executive Director of the Emergencies Program, and Dr. Maria Van Kerkhove, Technical Lead for COVID-19, who will answer your questions after Dr. Tedros has made some opening remarks. As usual, we are translating this simultaneously in the 6 official UN languages plus Portuguese and Hindi. And remember that under the quirky Zoom system, you need to go to the Korean button to use Arabic. So now, without further delay, I will hand over to Dr. Tedros. Dr. Tedros, you have the floor.
Thank you. Thank you, Margaret. After my statement, I will leave. I will not be staying for the Q&A, and my colleagues will continue because I have another commitment, so I'd like to ask you my apologies for that in advance. Good morning, good afternoon, and good evening. This week, we will reach 20 million registered cases of COVID-19 and 750,000 deaths. Behind these statistics, there is a great deal of pain and suffering. Every life lost matters. I know many of you are grieving and that this is a difficult moment for the world. But I want to be clear. There are green shoots of hope, and no matter where a country, a region, a city, or a town is, it's never too late to turn the outbreak around. There are 2 essential elements to addressing the pandemic effectively. Leaders must step up to take action, and citizens need to embrace new measures. Some countries in the Mekong region, New Zealand, Rwanda, and many island states across the Caribbean and the Pacific were able to suppress the virus early. New Zealand is seen as a global exemplar, and over the weekend, Prime Minister Jacinda Ardern celebrated 100 days with no community transmission, while stressing the need to remain cautious. Rwanda's progress is due to a similar combination of strong leadership, universal health coverage, well-supported health workers, and clear public health communications. All testing and treatment of COVID-19 is free in Rwanda, so there are no financial barriers to people getting tested. And when people test positive for the virus, they are isolated, and health workers then visit every potential contact and test them also. Getting the basics right provides a clear picture of where the virus is and the necessary targeted actions to support transmission and save lives. This means that where there are cases, the government can quickly implement targeted measures and focus control efforts where they are needed most. Other countries like France, Germany, the Republic of Korea, Spain, Italy, and the United Kingdom had major outbreaks of the virus, but when they took action, they were able to suppress it. Many countries globally are now using all the tools at their disposal to tackle any new spikes. Over the last few days, UK Prime Minister Boris Johnson put areas of Northern England under stay-at-home notifications as clusters of cases were identified. In France, President Macron introduced compulsory masking in busy outdoor spaces of Paris in response to an increase in cases. Strong and precise measures like this, in combination with utilizing every tool at our disposal, are key to preventing any resurgence in disease and allowing societies to be reopened safely. And even in countries where transmission is intense, it can be brought under control by